Hello, and thank you for your interest in the UIC School Nurse Certificate Program. I am Eileen Moss, a teaching assistant professor and the director of the program. I'm going to give you an overview that will help you understand the process of becoming a certified school nurse through UIC. So why choose school nurse certification? Well, professional certification in every area of nursing is best practice. School nurses often enter practice with no formal education or guidance. It is important to understand the laws that govern school nursing and the state mandates that direct our practice. In this program, we will work to expand your knowledge, skills, and abilities in the specialty of school nursing practice. The concepts that you will learn will strengthen your ability to advocate for the health of your students and the school community. The coursework will prepare you to take the state and national certification examinations. After you pass the Illinois School Nurse Content Exam, you will be eligible to hold an Illinois Professional Educator License, Certified School Nurse. Your credentials will be PELCSN. The courses are not required for national certification, but they certainly prepare you for the exam. You may sit for the national certification exam if you have been a practicing nurse for 2 years. Once you have a professional educator license, you are eligible to receive the benefits and salary that applies to certified staff in your district. I want to emphasize that the program is not just about getting certified. It is an education in how to practice as a competent school nurse. You will learn how to practice safely in the school setting. We've heard many school nurses say that after they completed the program, they realized that they didn't know what they didn't know. So why choose UIC for your education? Our program has been available for over 30 years, and we're the pioneers in online education by transitioning to an online learning platform in 1998. The program offers a flexible design for school nurses that suits the lifestyle of learners with full-time jobs. The UIC faculty are nationally recognized experts in school health and leaders in school nursing practice. The most notable accomplishment among our faculty are their contributions to the practice of nursing in the textbook titled School Nursing, a Comprehensive Text. UIC's Dr. Kathy Yonkaitis and Dr. Robin Shannon worked with Dr. Janice Seligman from the University of Delaware as co-editors of the third edition of this book. Published and copyrighted by the National Association of School Nurses, this text serves as the national curriculum for school nurse preparation programs, as well as a major resource for practicing school nurses. The UIC certificate program was designed by Drs. Kathy Yonkaitis and Robin Shannon, so I'm pretty sure we are on track with what school nurses need to learn. What makes our program unique is the education and experience of the faculty in the program. All of our faculty are or have been practicing school nurses with experience in a variety of school settings. Many are doctorally prepared and hold national and state certifications in school nursing. As dedicated educators, they have contributed to the practice of nursing with publications and educational materials that enhance school nursing practice. They are invited presenters at the National and State Association of School Nurse Conferences. I'll introduce our faculty. From left to right is myself, Eileen Moss, the director of the program. And across the top of the page is Dr. Karen Madura, Dr. Kathy Yonkaitis, Dr. Robin Shannon, Anne Marie Riccio, Dr. Jinsun Baek, and Mary Noga. There are 2 other faculty not pictured in this slide, Dr. Sherry High and Destiny Sadowski. The information that we teach in the program is aligned with standards of practice from the National Association of School Nurses and the Illinois State Board of Education School Nurse Standards. The standards are the professional expectations of school nursing practice to ensure that students receive quality, equitable nursing care in school. The UIC program consists of 3 courses that provide 10 graduate credit hours. The courses can be completed over 2 or 3 semesters. Most school nurses complete the program in 2 semesters, but we allow for a 3-semester program in the event that life circumstances get in the way of the student's progression. You can choose to start the program in the fall or the spring semester. Fall begins in August and spring begins in January. The courses are all online and asynchronous, which means that you can do your work when you have time. We meet via Zoom in the evening several times a semester, but if you are unable to make the session, there is a recording available. During the first semester, you will take 2 classes. The first course is Education Perspectives in School Health. This is a 4-credit-hour course, and it lasts for 8 weeks. It combines the educational psychology and exceptional child content as required by the Illinois State Board of Education for licensure. In some programs, nurses complete these courses within the College of Education. UIC created a course specifically for school nurses to meet the requirement of those other 2 courses to make it more applicable to practice. In this class, you will learn how children develop and learn. The content places an emphasis on the school nurse's role in the special education process with the development of an individualized education program, or IEP. School Nursing Theory and Trends is a 3-credit-hour course that runs in the last 8 weeks of the semester. This course places an emphasis on caring for students with chronic health conditions and special health care needs. Nurses learn how to manage the health needs of a student population and to manage a school health program. We teach how to write a 504 plan, an emergency action plan, and an individualized health care plan for a student with a health condition. The internship course is taken in the 2nd semester of the program. This course is worth 3 credits and can be completed in 1 or 2 semesters. During this internship, the nurse completes 300 clinical hours in a school. 260 of those hours are completed in the workplace during normal work hours. At least 40 of the hours must be completed outside of your typical school setting. Students must meet this requirement by visiting other schools, attending meetings, conferences, webinars, and other training activities. The outside hours do not require the school nurse to miss any work days. Employment in a school setting during the internship is preferred, but if you don't work in a school, we can help you make arrangements for your internship location. Interns have a preceptor who must be an experienced certified school nurse. We ask you to identify your own preceptor, but we will help you if you don't know anyone. Now we'll talk about how to apply for the program. These are the documents required for the application. You'll need an active RN license, electronic copies of all transcripts after high school. So if you went to more than one college to obtain your bachelor's degree, you'll need to get transcripts from all of the schools. Other items include a resume, a personal essay, and a letter of recommendation. We suggest that you put your heart into your personal essay. Tell us about your passion for school nursing and why you have a goal to be certified. Get a letter of recommendation from your principal or administrator that boasts about your dedication to school nursing. This letter is even stronger if they can tell us why it is important for your district to have a certified school nurse. The application process is competitive because we typically have more applicants than we have the capacity for. So if you submit your application, know that admission is not guaranteed. Applications are scored, so it is important to have a good personal essay and letter of recommendation. We attempt to admit everyone, but sometimes we just don't have enough space. After you apply, we will review your application for the admission requirements. The coursework that you took as an undergraduate has to meet certain criteria in order to meet the licensure requirements with the Illinois State Board of Education. Applicants must have an RN license with a bachelor's degree of science in nursing from an accredited institution. If you don't have a BSN and you have a bachelor's degree in another area, you can still apply. We will then review all transcripts, whether you have a BSN or not, for the required courses. The required courses are social science, psychology, human growth and development, mental health nursing, health assessment, community or public health nursing, and concepts or processes for contemporary practice, which is usually a theory or leadership course. If you haven't taken the required courses, you can still be admitted to the program, take the courses through the UIC RN to BSN program, and roll right into the certificate program the semester after those courses are completed. Here is a summary of the tuition costs. Students are assessed e-tuition at $848 per credit hour and have to pay a $19 fee for technology and library support. Please note that there are additional costs for resources and books, and a payment plan is available through the Office of Financial Aid. It is estimated that between tuition and books, the cost is about $8,600. That may sound like a lot of money, but it is a great investment in your school nursing career. Remember, once you have a professional educator license, you will be eligible to have the salary and benefits that the teachers enjoy. I must say I'm glad that I invested in my certification some 20 years ago. Certificate programs do not qualify for federal student loans. However, if you complete these courses as part of a master's or a Doctor of Nursing Practice degree plan, they can be covered on the loans. So after you are enrolled, we encourage you to apply for grants and scholarships through the Illinois Association of School Nurses Foundation and the National Association of School Nurses to help with your educational expenses. We encourage you to apply early because the application deadlines are set by the university and are non-negotiable. If any of your documents are missing when the deadline arrives, your application will not be accepted. Applications for fall are due on July 1st, and for the spring semester, they are due on November 1st. You can start the process and go in and out of your application. We recommend that you create an account and order your electronic transcripts first. The next step is to identify a professional reference. In your application, you indicate the name and email address for the person that you choose as your reference. They will then receive a request to submit a letter directly to the university. This process sometimes takes longer than expected depending on how busy your reference person is, so you will want to start that process early. The last step is to begin working on your personal statement. It's not a complicated process, it just takes some planning. So get started today. If you have more questions after listening to this presentation, I'm happy to answer them via email or over the phone. Please email me your questions and your contact information and I'll get back to you. Thank you so much for considering UIC for your school nurse certification. I am confident that you will be glad you enhanced your education with us. Have a great day.